Have you ever wondered how crucial communication is in the realm of public health? It's not an exaggeration to say that it's the lifeblood of the entire field. So let's explore this topic together. Public health is all about promoting health and well-being at individual, group and community levels. And one of the vital tools to achieve this is, you guessed it, communication. But not just any communication, it needs to be effective, clear, and tailored to the audience. Why, you ask? Well, consider this. How can we convey important health messages to the public if those messages are not understood or, worse, ignored? This is where the evidence-based rationale comes in. It's essential that the health messages we communicate to the public are backed by evidence, ensuring they are accurate, reliable, and therefore trustworthy. But let's not forget about rapport building. It's not enough to just deliver information. We need to engage with people and groups to uncover their health and well-being concerns. This engagement allows use to provide them with information that is relevant and valuable to their unique situations. It's about creating a two-way street of communication where we both provide information and listen actively to the concerns and needs of those we're trying to help. Of course, it's not always smooth sailing. There can be barriers to communication like sensory disabilities, neurodiversity, low literacy levels, language differences, or cultural nuances. These barriers may affect a person's understanding of health messages, but don't worry, we have strategies to overcome these, which we'll delve into more in later scenes. Lastly, in today's digital age, we're not just limited to face-to-face communication. We have a plethora of platforms at our disposal, including social media and other digital technologies. These platforms can help us reach a wider audience and promote health messages more effectively. So, as you can see, communication isn't just about talking or writing. It's about connecting, understanding, and engaging with people to promote health and well-being, and that's why effective communication strategies are integral to promoting health and well-being at all levels. Stay tuned for more insights in our next scenes. So, what are these public health messages and why are they important? Public health messages are the guiding principles, advice or information provided by health organisations and professionals to the public. They're designed with the intention to promote health and well-being. These messages are backed by scientific evidence and research, making them a reliable source of information for individuals, groups and communities. Take, for instance, the well-known message, 5 a day keeps the doctor away. This is not just a catchy phrase. It is based on research showing that eating at least 5 portions of fruits and vegetables each day can significantly reduce the risk of heart disease and certain types of cancer. These messages are important because they provide the public with actionable information to improve their health. They're aimed at influencing health behaviours like encouraging regular exercise, promoting a balanced diet, or discouraging smoking. But it's not just about individual behaviour. These messages also have a broader societal impact. They can influence policies, drive public health initiatives, shape community programs, and even alter social norms. Understanding these messages is not just about knowing what they say, it's about understanding why they say it, the evidence-based rationale behind them. It's about knowing the why behind the what. For example, let's consider the message to wash hands regularly. This isn't just good hygiene advice. It's a scientifically proven measure to prevent the spread of diseases, particularly those that are transmitted by touch. Understanding this rationale can make the difference between seeing hand washing as a casual suggestion or a crucial preventive measure. The more we understand these health messages, the more effectively we can use them to make informed decisions about our health and well-being. In turn, we can share this knowledge with others, creating a ripple effect that promotes health across our communities. As we delve deeper into this topic, we'll explore more about the components of effective communication, the barriers we may face, and the strategies to overcome them. But for now, let's remember, understanding these health messages is the first step towards a healthier society. Communication is more than just words. Are you aware of the different components of interpersonal communication? Let's delve into this fascinating realm. First off, we have nonverbal communication, often underestimated, yet it plays a crucial role. It's about the messages we send through our body language, facial expressions, and gestures. For example, maintaining eye contact can signify that you're attentive, while crossed arms might suggest defensiveness. In a public health context, nonverbal cues can help convey empathy and understanding, making the health message more relatable and impactful. Next, we have paraverbal communication, which refers to how we say things rather than what we say. It includes elements like tone, pitch, rhythm, volume, and inflection in our voice. Ever noticed how a comforting tone can soothe a worried patient, or how a confident, clear voice can inspire trust in a health message? That's paraverbal communication at work. Now let's talk about active listening. It's an essential communication skill, especially in public health. It involves not just hearing, but understanding, reflecting, and responding to the speaker's words. It's about showing genuine interest and respect for the speaker's views. By practicing active listening, we can better understand people's health concerns, making our health messages more effective and personalized. However, it's not enough to understand these components. We must also adapt our communication style to the person or group we're interacting with. For instance, a health message might need to be conveyed differently to a teenager than to an elderly person, taking into account their different perspectives and experiences. In essence, effective interpersonal communication in public health is about more than just transmitting information. It's about building rapport, understanding, and trust. It's about respecting diversity and adapting our communication style accordingly. It's about using our words, voice, body language, and listening skills to make health messages more meaningful and impactful. Mastering these components can greatly enhance the effectiveness of communication in public health. While communication is key, there can be several barriers that prevent effective transmission of health messages. Do you know what they might be? When we talk about barriers to communication in public health, we're referring to factors that can hinder the understanding and interpretation of health messages. These barriers can be as varied as the individuals and communities we're trying to reach. First, let's consider sensory disabilities. For someone with a hearing impairment, audio messages may be ineffective. Similarly, visual messages might be lost on someone with a sight impairment. Therefore, it's crucial to design health messages that cater to a variety of sensory needs. Next, we have neurodiversity. People with different neurological conditions process information in unique ways. For instance, someone with autism might prefer clear, concise messages, while someone with dyslexia may benefit from visual aids. Understanding neurodiversity helps us tailor our communication strategies to ensure everyone can comprehend our health messages. Thirdly, literacy levels can significantly impact a person's understanding of health information. Low levels of literacy or health literacy mean that complex medical jargon or dense texts can be challenging to comprehend. Hence, it's important to keep health messages simple, straightforward, and accessible. Language and cultural barriers also play a significant role. People from different linguistic backgrounds or cultures may interpret health messages differently. There might be words, phrases, or concepts that don't translate well, or cultural beliefs that influence health perceptions. So it's important to be culturally sensitive and considerate in our communication. Lastly, let's not forget the digital divide. Not everyone has equal access to digital technologies or social media. For some, digital literacy might be a challenge, while others might not have access to the internet or devices at all. So, while digital platforms can reach a wide audience, they should not be the only method of communication. In conclusion, effective communication isn't a one-size-fits-all approach. It requires understanding, empathy, and adaptability. Identifying these barriers is the first step towards overcoming them. Having identified the barriers, do you wonder how we can overcome these to ensure effective communication of health messages? Let's delve into strategies that can help us overcome these obstacles. One of the most effective ways to navigate through communication barriers is to understand and respect the cultural differences that exist within our audience. This includes not only the obvious elements like language, but also the subtle nuances that are often overlooked, such as the use of symbols, gestures, and even the concept of personal space. By being culturally sensitive, we can ensure that our health messages are not just heard, but understood and accepted. For those with sensory disabilities, we can employ alternative communication methods. This might mean using sign language interpreters or closed captioning for the hearing impaired, or providing information in braille or with large print for the visually impaired. When dealing with neurodiversity, it's important to remember that everyone's brain works differently. This means that the way we convey information needs to be flexible and adaptable. For example, some people might prefer visual aids, while others might benefit from repeated explanations or demonstrations. Low levels of literacy or health literacy can also be a significant barrier. To overcome this, we can simplify our language, avoid technical jargon, and use visual aids to make our messages more digestible. Remember, the goal is not to impress with our knowledge, but to educate and empower. And finally, language barriers. It's not enough to translate our messages word for word. We need to localize them, taking into account the cultural context and colloquial expressions of the target group. This way, we can ensure that our messages are not lost in translation. In this digital age, we can also leverage technology to our advantage. Social media, for instance, can be a powerful tool to disseminate health messages to a wide audience. By understanding the digital habits of our audience, we can tailor our messages to fit the platforms they frequent. Overcoming communication barriers is crucial. to ensuring that health messages reach and benefit everyone. Let's continue to strive for better communication in public health, because when we communicate effectively, we create a healthier world. In this age of digital technology, do you know how it can be leveraged to promote health messages to a wider audience? This question is more relevant than ever as we navigate a world where information is just a click away, where connectivity is instant, and where health promotion has found a new playground. The use of different communication methods in health promotion has evolved significantly over the years. Traditional methods such as print media, television, and radio broadcasts have been effective, but they are no longer the only players in the game. The digital revolution has ushered in a new era of communication, and health promotion has been quick to adapt. Social media platforms have become ubiquitous in our lives, and they are powerful tools for disseminating health messages. These platforms can reach a vast and diverse audience, breaking down geographical barriers. Facebook, Instagram, Twitter, YouTube, to name a few, are leveraged to share evidence-based health information, promote health campaigns, and engage with the public in real time. Furthermore, the use of mobile applications for health promotion is on the rise. These apps provide personalized health information, track health behaviors, and offer interactive elements to engage users. They can be tailored to address specific health concerns, making them a versatile tool in health promotion. Health websites and online forums also play a crucial role. They offer a platform for individuals to access, share, and discuss health information. They can also host webinars, live chats, and Q&A sessions with health professionals, promoting a two-way flow of information. Email campaigns are another method that remains effective. They allow for the dissemination of health messages directly to individuals' inboxes, making the information easily accessible and personalized. But remember, while digital technology offers numerous opportunities, it also presents challenges. The risk of misinformation, privacy concerns, and digital divide are real and must be addressed to ensure the effective use of digital technology in health promotion. Digital technology provides a powerful tool for disseminating health messages to a wide audience. It's our responsibility to harness this power effectively and responsibly in promoting health and well-being. As we wrap up, do you recall the key points we've discussed today? In the realm of public health, effective communication is paramount. It's not just about getting the message across, but about building a rapport with individuals and groups, understanding their health and well-being concerns, and providing them with the information they need. This isn't a one-way street, but rather a dialogue that allows us to engage, inform, and learn from those we're trying to help. We delved into the current health messages aimed at the public and the evidence-based rationale behind those messages. It's crucial to remember that these messages are not plucked out of thin air, but are grounded in scientific research and public health best practices. Understanding these messages and their rationale can help us communicate them more effectively and persuasively. And let's not forget about the components of interpersonal communication. Non-verbal cues, paraverbal communication, and active listening all play a significant role in how we communicate, they can greatly affect the way our messages are received and understood. Mastering these components can make us more effective communicators and can enhance the impact of our public health messages. But communication is not without its challenges. We talked about the barriers that can hinder a person's understanding of health messages, such as sensory disabilities, neurodiversity, low literacy levels, language differences, and cultural factors. These barriers can make it difficult for some people to grasp and apply the health information we provide. Yet we are not without tools to overcome these barriers. Tailoring our messages, using plain language, providing visual aids, and leveraging cultural competence are all strategies that can help us bridge the communication gap and ensure our messages reach everyone regardless of their individual circumstances. And lastly, we covered the use of different communication methods in promoting health messages. The digital age has provided us with a plethora of platforms to disseminate information, from social media to mobile apps and websites. These technologies allow us to reach a wider audience and tailor our messages to specific groups, making our public health campaigns more targeted and effective. So let's take a moment to reflect on these key takeaways. Effective communication in public health requires a deep understanding of our audience, a mastery of different communication components, a keen awareness of potential barriers, a toolbox of strategies to overcome these obstacles, and a savvy use of digital technologies. It is a multifaceted process, but one that can yield significant benefits for public health. Remember, effective communication is a powerful tool in public health that, when used correctly, can promote health and well-being at an individual, group, and community level.